You have been diagnosed with cracked tooth syndrome. What is cracked tooth syndrome? Cracked tooth syndrome is a condition where a tooth has fractured. The nerve inside the tooth is still alive, and usually no part of the tooth has yet broken off. Teeth most commonly give a twinge on biting, however, the pain can be more severe. If the crack gets worse, it could kill the tooth and cause a subsequent dental abscess. The aim of treatment is to eliminate any discomfort and stop the crack from getting worse. In this photo, multiple cracks are seen. However, the tooth does not exhibit cracked tooth syndrome, and no treatment is required. In cracked tooth syndrome, the crack is often invisible, both in the mouth and on X-rays. This makes diagnosis difficult. Treatment options. There are 3 treatment options for cracked tooth syndrome. All interventions are undertaken by painless technique under local anesthesia. The first treatment option is no treatment. This is rarely recommended as it leaves the tooth unprotected and at an increased risk of crack propagation. Direct composite onlay. This is a white filling that covers the whole top of the tooth. This protects the tooth and reduces flexing forces while chewing. The onlay is made of a type of reinforced plastic, so the onlay will flex or bend more than a ceramic alternative. This means that the crack can still be flexed underneath the onlay, albeit to a lesser extent. It is quicker and cheaper to place a direct composite onlay than a ceramic alternative. Crown. The third treatment option is crowning the tooth. This is a piece of hard ceramic that fits over the whole top of the tooth. It covers more of the tooth than an onlay and is less flexible. More of the tooth is removed when preparing it for a crown than for an onlay. Crowning a tooth is more time-consuming and expensive than placing a direct composite onlay. In this graphic, you can see inlays, onlays, which just protect the very top of the tooth and prevent you from flexing apart the different parts of the tooth, and a crown, which fits over the whole top of the tooth. Treatment failure. The risk of failure of a composite onlay is approximately 30%. The risk of failure of a crown is approximately 20%. Should initial treatment fail, further treatment, including root canal therapy, may be advised. In summary, diagnosis is difficult. We often confirm the diagnosis after the initial treatment is or isn't found to be successful. There are 3 initial treatment options. We can choose not to treat the crack, or to treat the crack by either a direct onlay or a crown. Should initial treatment fail to treat your symptoms, root canal therapy is an effective next step. You will be provided with up-to-date treatment fees for comparison. Please consider these options at your leisure. When you have decided on your preferred treatment option, or if you require more information, please contact the practice. Until the tooth is treated, it is recommended to chew on the other side of your mouth. This is to reduce the risk of crack propagation before treatment completion.